Um, how many, can we just do quick introductions after I introduce myself, just so I get a sense of who's on the call? But one thing I just wanted to clarify. So I'm no longer at IPAS. I'm now Vice President of Programs at the Global Fund for Women. And we are a feminist foundation and fund that believes in decolonizing and democratizing philanthropy. And so what we do is raise money primarily from individual, institutional, and government donors in the US and in Europe, so in northern countries where there is a lot of wealth and capital, and we give grants and provide grants and support feminist and gender justice and youth-led organizations and movements across the globe working to advance intersectional and intergenerational human rights. And so one of our portfolios and one of the bodies of work we support is sexual and reproductive health rights and justice with a focus on abortion. So just to clarify that, I'm still, of course, a very strong SRHR activist and advocate, but I left IPAS in 2016.
Yeah, thank you for that clarification. And we are very happy to have you here, and we look forward to a very engaging session forward. So to give you, I'll begin with the introduction of myself. And so my name is Vinita, and I have been working at the YP Foundation since January. And and yeah, so, and I primarily have been working on, my area of interest is oral history and gender and SRHR issues. So that's my introduction. So if anyone can begin, please go ahead.
Hello, may I?
Yeah, sure.
Yeah, hi, I'm Krishanu. My pronouns are they, them. I identify as a trans non-binary person. I have completed my undergrad in political science from University of Delhi, and now I'm looking forward to go in academia in sociology. Apart from that, I have worked in a lot of support group type organizations with students in DU, and we have started a sort of a very when this entire idea of gender and which was being very questionable for us. So we started a group called the Non-Binary Collective Delhi, but later we turned it to Nan Biryani Delhi because that was something that looked more fun. And so yeah, that is a collective where we support non-binary people, and I'm also involved in a lot of organizations where we do a lot of intervention work, and otherwise also just being a part of the community, have been doing a lot of intervention work with the community. So yeah, it's going to be fun. I'm looking forward to the session.
Thank you, Krishanu. And I should have mentioned, I apologize, my pronouns are she, hers. They're next, she, her, hers. They're next to my name. And sorry, I didn't mention that when I introduced myself, but nice to meet you.
Okay, hi, I am Deepika, and I'm also working with the YP Foundation since January. I'm working in the program called SAFE, which is Safe Abortions for Everyone. And yeah, I'm sorry, my camera is not working, so I cannot open video.
No worries. Nice to meet you. I'd love to learn more about YP's work on abortion. Thank you.
And I also go by she, her pronouns.
Hello, Leila, and this is Biraja. My pronouns are she, her, and I currently I have pursued my master's in gender studies, and I identify as a transgender woman. And my interest area looks at transgender rights, gender, city spaces, and accessing rights, not from a legal perspective, but from a everyday discourse of living, survival strategy, and all of that. I look at the discourse of right through that lived experiences. And also I have been working with my community since 3 years about legal activism, like accessing legal aid for identification change and accessing health. And so, yeah, this course is helping me understanding legal discourse, like discourse of abortion better, so that it will also be helpful for my community and my work. Thank you, and looking forward to this session.
Do others want to jump in?
Hi, I can go next.
Hi.
Hi, this is Ramneek and my pronouns are she, her. And I've been a development sector professional for about 11 years now, and I've worked primarily in the youth development sphere on multiple issues. I identify as a feminist, and I'm really passionate about exploring intersectionality within the feminist space. And recently, I have started a project called Pleasure Circle, where I want to speak about pleasure in a positive way with a bunch of women. So I'm just piloting this project and hoping that it, uh, it would take flight. Thank you.
Hello, my name is Dimple, and I have completed my MA in political science. And I have also done many work with many NGOs, uh, like Youth for Seva, uh, where I done session for girls, menstrual hygiene, and many other sessions like a good gift paper bag I done, and that's it.
Hello everyone, my name is Bineet Prakash and I am currently pursuing Master of Social Work from Tata Institute of Social Science, Guwahati campus. And I run my own organization in Bihar, which is working for women empowerment, environment conservation, and I'm largely involved in the various, with various organizations which is working on the gender and justice, anti-human trafficking, and yeah, looking forward for this session.
Should I go next? Am I audible?
Yeah.
Yes, yes.
Yeah, hi everyone. My pronouns are she, her. I'm an intern doctor working in Mumbai. I am interested in the field of SRHR vis-a-vis public health, especially working with GBV survivors. Looking forward to this session.
Hi everybody, my name is Chetna Upadhyay. I'm working with National Human Rights Commission. I have worked with exclusively. I'm a lawyer. I was working in sexual and reproductive rights in the state of Odisha, and I used to take cases of sexual reproductive rights to court, and it was a very challenging situation that way. So I'm here. So court cases actually takes a lot of time if you see the duration. So I'm here to explore a lot how can be done in a more positive way, and the can be really little fast. Thank you. Looking forward to the session.
Hello, this is Riddhi, and my pronouns are she and her. I am doing my master's in counseling psychology right now, which is what actually brought me to learn and understand more about abortion, because this is not something that's very dealt in depth in our courses, but it's really very important. So that's what I'm here about. And all of you who've spoken till now, it's so nice to have you here. You guys are doing such nice work. Thank you so much.
Hello, um, my name is Aradhna, and my pronouns are she and her. I have just completed my undergraduation, and I'm actually thinking of exploring a field in the development sector. So that's why I opted for this course, because, as mentioned before, abortion is not talked about at all. I can't recall a single time where anything related to it was discussed. So I thought it would be an interesting way to learn more about the intricacies and complexities of this.
Thank you, Radna. Uh, I I think Leila's connection has gone. Can you see it on the participation room?
Yeah, we can see her.
I can still see you.
Oh, okay. I'm so
Yeah.
sorry.
No worries.
So, hello everyone. My name is Ashwarya, and I recognize myself with the pronouns she, her, and hers. And I have been working with women between the age of 15 to 60. And I, in my personal work of experience, have found a lot of phobia around abortion and sex. And in my work as a clinical psychologist with this age group, I thought that as a professional, I need to know more about it. So I did my master's. I'm a double master's, one from TIS in education and one in clinical psychology. So I was looking forward to learn more about these aspects, and I'm really excited to hear from you, Leila. Thanks.
Um, Hi, I'm Harshita. My pronouns are she, her. I'm in my final year of Masters in Sociology from Delhi School of Economics, and I'm really interested in areas of sexual and reproductive health and rights, and body politics. And yeah, I'm looking forward to this session. Thank you.
Hi, Shweta.
Hello everyone, I am Mausami. I'm a recent law graduate and currently working as legal researcher with Delhi State Legal Service Authority. I am really interested in working in cases of prevention instead of prosecution and punishment. And one of the reasons that I am interested for today's session and specifically in this course because in my area of working, I have been coming across a lot of intersection with the criminalization of the sexual relationship between adolescents and a lot of young people and their families coming in for counseling and also things like contraception and abortion cases even. So I'm pretty interested in learning a lot about all of this except from the legal aspect that I've already covered in the law school.
Hi, I'm Shruti and I work at the YP Foundation. I manage the Access project at YP and I also work part time in the SAFE program. I am also looking forward to the session today. My pronouns are she and her. Can I just recruit the next person? Can I request Manu? If Manu hasn't introduced, then.
Hi, I'm Manu. My pronouns are she and her. I'm a teaching learning lead at Shivnadar School. And yeah, just like everyone else, I'm really looking forward to your session. So shall I well tag someone else? Um, okay, if Ramneek has introduced herself, great. Otherwise, Ramneek or whoever wants to go next.
I think Ramneek did. Bhavna, can you hear?
Mm-hmm.
Okay, Bhavna, Chetna, Sangeeta.
I have introduced myself already. Chetna here.
Hey, my audio seems a little bit off. So I have not been able to speak until now.
Please go ahead. We can hear you now.
Yeah, I'm Sangeeta. I work as a professor of English at the Indian Institute of Journalism and New Media, Bangalore.
Okay, who hasn't introduced themselves can maybe do a
Hello?
hand.
Hello?
Hi.
Actually, I'm having a problem with the network. Can I go ahead like 2 minutes later if somebody else is left? Hello?
Yeah, sure.
I could go next. Am I audible?
Yes, you are.
Okay. So my name is Saima. My pronouns are she/her. I am a 20-year-old woman, and I am in my last year of undergrad in psychology. I am also looking forward to the session. Yeah, I think that's it.
Great. Is that everyone? Has everybody had a chance to introduce themselves?
Hi.
Hi. Hello?
Yes.
I'm Bhavna. I recently completed my graduation from Delhi University and I'm looking forward to the session.
Hi, this is Muthugunti Talukdar. I'm a research assistant in Jamia Millia Islamia, New Delhi. I've completed my BA and MA in sociology, and I've always been interested in issues of feminism and gender justice. So, yeah, that's why I joined this course, and I'm looking forward to the session.
Hi everyone, it is Kanishka. I recently did my undergrad in economics from Delhi University, and during my undergrad, I was really fascinated with development economics as a subject, and I'm really looking forward to the session today to learn more about development in SRH and yeah.
Great. I hope that's everyone.
Hello? Hi.
Yes, please go ahead. Yes.
Hi, I'm so sorry for the delay.
No.
I'm Anandita Pathak. I'm from Guwahati, Assam. I'm a 21-year-old and I'm presently pursuing my bachelor's in history. I'm in my final year. And about the issues related to feminism and gender equality as a whole. And that's why I'm looking forward to the session as well as the course. Thank you.
Great. So I think that's everyone. And just welcome to everyone. It's so great to just hear the diversity of men, women, gender, non-binary, trans participants, all the ways that you think about intersectionality. I really appreciated the person who brought up pleasure and joy. That should be a central part of our work, and also our liberation and the ways that we think about rights and justice. So I really appreciated that, the focus on human rights. This isn't just about health, but this is fundamentally about self-determination, bodily integrity, and human rights. And I just love the energy and diversity in the room. So thank you all for attending. I didn't have a real sense of everything else that you've covered today. I know that you've done some aspects of the legal work and also a little bit about stigma. So I hope this presentation, sorry, can you all hear me?
Yes, yes, we can hear you.
Okay. So I hope this presentation is helpful. What I thought we would do is I would just go through a presentation that's a little bit more around stigma and values and language and different ways of thinking about abortion in this broader context of also pleasure and joy and rights. And then we could just have an interactive session. And if we want and have time, we could also break out into smaller breakout sessions. I just saw there's somebody in the waiting room. I don't know who needs to admit them. But I hope that works for everybody. So I'm just going to go through this.
Can everyone unmute themselves, and whenever they wish to, like, come bring out a point, they can. Yeah.
Sorry, I don't think I heard that. Was that a question?
Oh no, like I was
Okay.
suggesting, like if we can mute ourselves, and whenever
Yes.
anyone wish to like
Okay,
put across a
perfect.
point. Yeah.
Okay. Okay, great. Okay, so sorry. Let me just pull up. Okay. So in terms Can you mute? Yeah. Okay, is it okay? I'll begin. So really thinking about the conversations that you all have had to date, and really thinking about how we shift the ways that we think about abortion, the ways that we approach abortion. And a lot of this is grounded in our values, in how we think about sexuality, in how we think about gender. And so I just wanted to note some of that it's really important when we think about our work and activism, and Suvik said yesterday that you all are involved in communication campaigns, to really begin often with thinking about our values, where they come from, who benefits from certain ways of seeing social norms and gender roles and identities, and who doesn't, and really to think about how that plays out. We also know that abortions happen in women and people who can become pregnant's bodies. And that may seem obvious, but I think it is very linked to how we think about gender, the unfortunate binary we have. And it's great to hear some of the activists who are engaged in non-binary conversations and breaking that binary. That feels so important to the work that we're doing on abortion. It's also really essential to think about human rights. Human rights are universal, they're indivisible, and they're inalienable. They're not determined by geography or gender. And so everybody has the right to decide if, when, and how many children they will or will not have, and the right to terminate a pregnancy regardless of the conditions or reasons for that pregnancy. And I think that's really important, because I know, having done some work in India, that there's the debate around sex-selective abortion and gender imbalance. And so regardless of the reasons why women need abortions and people who can become pregnant, they are critical and they are a key human right. So next slide. And I'll just go through these. If you have critical points that need clarity, please just join in the chat, and otherwise I'll go through these and you can save your questions for the end. One thing that we always highlight in the work that we do is that abortions, when are really safe medical procedures, as you know, certainly early abortions and abortions that are done safely with somebody who is a trained provider, and trained providers exist across the spectrum of health professionals. But what is really harmful is the abortion stigma, right? And I know that you had a session previously. Sorry, can somebody mute? I'm not hearing very well. I know you had a session on stigma, but it's really the stigma that is so damaging and dangerous to people, because it disqualifies an individual from social acceptance. Abortion stigma links women, and I would add here people who can become pregnant, to deviant stereotypes, and it links them as unworthy and degrades them as key members of a community. Next slide. So where do we encounter stigma, and how do we perpetuate it? People talk about abortion as a matter of beliefs and morals, but we rarely acknowledge abortion as a liberatory and moral act. fact that abortion is something that is a right and is something that is moral. And I'm sure that many of you know Dr. Nozar Shariar, who is an Indian gynecologist. He is or was, I'm no longer sure if he still is, head of the Indian OBGYN Council, and is a very, very strong and articulate and feminist supporter of women's rights and people's rights to abortion. And one of his key declarations was this one, that anything 46 million women do every day can't be immoral. And that's the number of abortions, as you know, that happen globally. Next slide. So while we know that stigma works on thoughts and feelings that we have, we also have agency around sexual and reproductive rights. And it's important that we are able to articulate those and understand that for many people, having an abortion and being able to decide if they carry a pregnancy or not to term is one that is liberatory and something that can be a very positive experience. As this person has said, I've never once regretted abortion. It was a defining moment for me that has given me great strength to create a meaningful life. And I'm just flagging this because we know that also abortion can be an incredibly hard choice as well for some people, and that there are also women who feel that they're coerced into abortions. That's also the reality of our world. But too often, the negative aspects are the ones that are highlighted and the negative stories. And so this is really important to also capture the beauty of being able to make choices and have options in life, as challenging and difficult as those options are, because our lives are messy. They're not always clear-cut and black and white. Next slide. So this approach, I really like the way that you all spoke. So next slide, please, about intersectionality and how important it is to think about a broad range of reproductive choice issues. And so what we think has been really impactful is to link the right to have a child with the right to not have a child, with the right to parent one's child, and with the right to have the enabling environment for parenting. And here in the United States, where we don't have universal childcare, we don't have universal time off when women and people who can become pregnant. And so what we do is we really link this spectrum of options in terms of having a child or not, but also being supported to parent a child and making sure that children are raised in safe and nurturing environments. And this is particularly important in the United States among people of color and Black Americans, because so many African Americans, as you know, are targeted by police and are not safe in their communities. So really thinking about choice and safety more broadly defined has been really, really critical. Next slide. So where do we start? I know that you all have been engaging in this conversation in different ways and have different access points. The next slide, I think that you did go in one of your presentations, next slide, on the ecological model for abortion stigma. But this has been one that has really been helpful for us in terms of thinking about communication campaigns and messaging, is to really think about who you're engaging with and at what level. Is it about individuals and individual speak outs and stories and experiences? Is it working more with the communities? And many of you spoke about the organizations you're involved in, the activism that you're linked to. So is it around influencing your communities? Some of you spoke also, some of you are healthcare providers or academicians. So are you looking to influence more your institutions and the institutional level? I heard that there are a couple lawyers in the House, so the legal aspect has been key. As you know, in most countries, abortion is criminalized or controlled by laws and policies. Then as a medical procedure, that doesn't need to be the case. There are countries like Canada that has no abortion law. And so the legal aspect has also been one where you have like the MTP Act in India, but where other countries use laws to regulate abortion. And then media and culture. And I know that some of you are launching media campaigns, so really thinking about who are your audience, what are your key messages, how are you using your values and your messages to influence these different levels of the ecological model, to have a more holistic approach to the social change that you're looking for. So these are just a few tools and resources that I just wanted to make sure that you all knew about, because they are tools that have been developed to think about values and the stigma around abortion and how we can think about dismantling that stigma and dismantling the values and root causes of abortion stigma, which really are linked to sexuality, to gender, and to gender norms. So I'll leave this presentation with you and you can come back to these tools and resources. So I'm going to keep going through this one. This is En-ROADS, which I'm not sure how many of you know about En-ROADS. En-ROADS is an international network for the dismantling of abortion discrimination and stigma. It is a network that was founded in 2016. It's a global network of health providers, of non-for-profit organizations, of individuals. And this is their website. There's a lot of very, very useful tools and resources that I recommend you use and access, both around the stigma work, the values work. They have a lot of also very, they have indexes and stigma scales that they use to measure stigma. They also do a lot of work around communication campaigns. So I just wanted to share this website because I think it's of interest to you. And then this is a video. I don't know, Sovik, if you're able to play this around reclaiming our language. Again, I'm bringing in some global examples. Yeah. Is that, are you able to play it? And if not, people can listen to it. Yeah.
I think I'm not able
Yeah,
to.
it's not someone not playing from the PPT, but if you have the link somewhere, like if you could just maybe WhatsApp me
Yeah,
or like
here.
email
Yeah,
me.
let me send you the link and see if it works. All right, so hold on. Does that work? See if that works. And if not, people can listen to it on their own afterwards.
Yeah, so we just trying that. I just sent it to Vinita. Vinita, if you could just check if it can be played from your device. Yeah, unfortunately, it's saying it's a private video, and I do not have access to this.
Okay, sorry about that. I'll figure that out later and send it to you afterwards. Sorry about that. Okay. So, but that video was really about using more positive language. It comes from Latin America. So look at it, and if for any reason it doesn't work, I can get back to the person. So next slide. So this is again about just the positive language that I mentioned earlier in terms of how we reclaim the right to abortion. So when a woman tells the truth, she is creating the possibility for more truth around her. And this is a project that Heather Alt has done, and it's called 4,000 Years for Choice. as you'll see the logo at the bottom. And what it is really looking at how historically and over time, women and people who can become pregnant have really thought about abortion as a critical part of women's just realities. And then if you look at it over time, it's really been in more recent years when criminal laws came into place. And that's really been in the last 50, 60 years or so when we've started to criminalize abortion. And for a long time, it wasn't criminal. It was more broadly provided by different levels of the healthcare system. And when it became more of a medicalized process and part of the criminal code, it was really part of the process of controlling women's bodies and putting into place more conservative social norms. And so this project, and I think it's important also just to think historically and globally at how we think about different examples of positive change and ways that women have always taken initiative to control their futures and to control their realities and can control their reproductive and sexual lives. So next slide. So I'm just going to give a few more examples of that work, of the breaking the silences and creating spaces work. So as you all know, next slide, please. This year, as you know, there's been some really great opportunities to change abortion laws in Argentina, for example, and in Oaxaca, in one of the states in Mexico. There's also been a lot of backsliding, as you know, and the Poland example was really critical. There's also been protests in the Philippines. There's been activism by midwives in Nepal. There's a lot of just mobilization across the globe. Notably in Latin America, that has some of the most restrictive abortion laws. As you know, there's 5 countries globally that forbid abortion for any reason, so there's no medical indication for abortion. And so these are just different ways of highlighting some of the activism that has been done. And one of the big areas that has shifted over time has been the prevalence and role of medical abortion or medication abortion, so that mifepristone or misoprostol or misoprostol on its own are being used for early abortions. And so in these cases, these are examples of abortion hotlines that have been set up across the globe, Indonesia, and we're supporters of those at the Global Fund for Women. So the Anti-Jane hotline is a hotline that exists in 22 countries across the African continent, so primarily in East Africa, but they're also working in former French colonies in countries that speak French as well as other languages. And they're basically like, I need to call a friend. You have an unwanted pregnancy, what to do? And these are numbers that you can call. They also have apps on their phones that people can use to get information on what to do if you have an unwanted pregnancy, where to access misoprostol or misoprostol and mifepristone. And then they help also to support women through a self-managed medical abortion. And I can take questions about this when we come back. These are some examples also of just the US, where there's been, by the time a woman reaches 45 years of age, 1 in 3 women or people who can become pregnant have abortions, and really highlighting how common it is, how frequent it is. Also highlighting the fact that, you know, in some states in the US, there are states where there is no abortion provider. And also in the US, you know, one of the wealthiest country in the world, we still have real issues around access both to abortion, but also to a range of contraceptive methods, especially for adolescents. And so it's hard to find in some states, it's unaffordable in others, and there are still parental controls in some states around contraception and abortion. And so basically there's been a lot of speak outs and dismantling some of the ideas around abortion, that it's harmful, that it's not common, and that it's not something that a lot of women, if not all women, experience somehow directly or through a friend, a mother, a sister, a daughter in their lifetimes. And then this is an example of just creating space for dissent. In the Philippines, as you know, again, a country where abortion is very, very restricted. It's only allowed to protect a woman's right to health or life and health. But again, in reality, that's not readily available. And so they really use this very strong imagery of a die-in to represent the voices that are dying because of unsafe abortions and the voices that are unheard. And so this was a public campaign. There was one in the Philippines, there was one in London, there was one in Ireland as well, where, as you know, until recently, abortion was also legally restricted. And so again, these are just examples of how groups are using public space to generate and create different conversations. And then also on social media, I know all of you, I'm sure, are very active on social media. This is an example of somebody who we supported. She's a disability and abortion rights activist who used her Twitter handle to tweet about her experience of having to travel. So women in Ireland used to have to travel, and in some cases still do, to the UK in order to get their abortions. And so this again was documenting her feelings, what happened when she got her abortion, and how, as a person with disabilities, how difficult that was, and how we always have to think about an intersectional approach in the work we do, because unless abortion is truly available and accessible for all, then it's not a right. And often we leave out and forget how challenging even legal services are for those with disabilities. So let's go on to the next slide, which is about creating a world without stigma. And I'm just going to give kind of some key steps that have come from some of our learnings, and then I'd love to take some questions and comments and hear back from all of you. So next slide. So these are 10 steps to challenging abortion stigma that have really come from the work that we've done, both at IPAS and as Global Fund for Women, and I think a lot of learnings that probably come from India as well and the work that you're doing. But one is just to create spaces of openness and safety. And people often, what we found, even when I worked at an abortion rights organization, people also had, conflicting perspectives and experiences. And for some people, there were red lines around if somebody needed many abortions, or if somebody needed a second or trimester abortion, or if somebody just refused to use contraceptives. So we really need to think and create safe spaces to understand openly how we can support the right and needs of all people at all times to the abortions that they need. And really to just open up spaces that are real, that are authentic, that allow for the tensions that we may have around abortion, because I think that's just being honest. And we live in a world that stigmatizes it so much that we often have stigma that we may not even know about. So that's one of the first steps. Second is really just to name the problem. And to describe the different contexts of stigma, the different ways that stigma plays out. To also recognize, as I mentioned earlier, our own role in producing and reproducing abortion stigma, even as activists and advocates and feminists and gender justice activists. We also produce and reproduce, because that's the world we live in. We live in a world that has criminalized abortion and stigmatized abortion. And so we really have to address that at the personal level, I think, to really be and show up as activists in the way we all want to. Doing work on the analyzing, addressing the root causes, documenting the negative effects, as I mentioned earlier. For early abortions are very, very safe. I know that people can have them in unsafe situations, but the medical aspect is safe when people are trained. But there really is a lot of negativity that comes from the stigma that people feel themselves and that our societies perpetuate. And so we really need to actively engage in challenging the judging and blaming, and not just be passive advocates, but be really anti those people who are anti-abortion. Building commitments to changing attitudes about women, supporting women and providers to overcome self-stigma and better manage stigma. And we know that among providers, there's also a lot of stigma that comes up around young people, around adult women, around women who come from more marginalized communities, and that is just very real. There are all ways that even if you look at how our health systems structure abortion in the US, it's not an integral part of medical schools or medical practice or even our healthcare systems. We have separate abortion centers. So even that idea that you would isolate it as something different is really, really stigmatizing. And then to develop strategies and plans to incorporate stigma lens and tools in the work that you do. And of course, Inroads is a great global community and movement for any of you who want to join, go to their website. It's just a great space to be able to reflect with others, strategize with others, and there's a lot of interesting tools and resources. And then let me just end with the final slide that, sorry, one more. I think that a non-stigmatized world is one where abortion isn't criminalized, but it's considered an integral part of people's health and a common and normal practice over which women and people who can become pregnant have power and control. And it's the final slide, if you want to just scroll down one more. And again, this language is somewhat binary, so I apologize for that. But that really is the vision, that ultimately we remove abortion from criminal codes. It's an integral part of our healthcare systems. It's an integral part of just people's realities, and that it's not something that's isolated out. And I think this is really the vision that we have for a human right to abortion for all people. So I hope that was clear. I know that was a lot of information. It's hard to present when it's a bigger group, but I'd love to hear your comments, feedback, ideas, questions, and we could also break out into smaller groups if you want to do more work on some of the campaign ideas that you all have.
Yeah, maybe it would be good for the participants if you have any reflections, any thoughts, anything to add to this, yeah, and any sharing you have, or any questions even. So maybe we can just start with that.
So Krishanu has a doubt, and they have asked, just wondering what is a midwife and how is it different from nurse?
A midwife and a nurse, was that the question?
Yeah.
Yeah, okay. So, so in different countries, I mean, this plays out differently, but traditionally there has been a strong role for midwives. For example, across the African continent, midwives are often those who are present in the communities. They assist women with birthing. They also often have a role with other just basic medical procedures and healthcare practices and vaccines, but they also play a role in abortion. So the International Federation of Midwives has come up with a statement, in fact, supporting midwives' roles in abortion. So in some cases, that's just identifying when women want an abortion and helping them get to a healthcare center. In other cases, if there are no healthcare centers close by, they also may give out misoprostol. In the United States, midwives in certain states like California are legally allowed to distribute medical abortion because they're closer in terms of just having proximity to the women and to the groups and communities that they serve. So they're more local, like community health practitioners, at least in the US and across the African continent. But if you look at, like, WHO has guidelines on abortion that look at how at different levels of the healthcare system, that everybody has different roles, from pharmacists to midwives to nurses to general practitioners to OBGYNs, and really looking at how we think about a more holistic approach to abortion care that includes roles and responsibilities for people across the healthcare system, if you will. Are there other questions or comments, or just things you're struggling with in the work that you're doing? Yeah, the ASHA workers, exactly. The ASHA workers are like the community healthcare workers. In Nepal, they have a name and I've forgotten it now, but yeah. So they're really the ones that are closest in many ways. The first focal points in communities is often the case.
Yeah, I just had at a personal level, like more of like, if others do not have right away any queries, just I had a thought, just wanted to understand from you, like how you've seen like the advocacy spaces where SRHR related, I mean, starting from like the ICPD or even from before that, and in the current UN spaces, in the advocacy spaces, or even in the movement spaces, like how you have seen like the abortion agenda or abortion discourse have kind of evolved. Like, has it kind of moved away in a certain direction? Like, what kind of shifts has happened? And yeah, if you could just your reflections on that, that would be really great to hear.
Yes.
Thank you.
Yeah. Thank you so much for the question, because there have been real shifts, but one thing that you always learn is that change is not linear, and that improvements can happen and then there's backsliding. And so I was very fortunate. So my background, I was born in North Africa and Algeria. I was raised in the United States, and then I studied public health and social studies, and then feminist issues, of course. And I went to Egypt in 1993. This shows my age. I'm sure many of you were probably not even born then, but to work on the International Conference on Population and Development. And that was a global conference where global communities, actors, UN, and governments are looking at their commitments around population and development. And that meeting was a landmark meeting because feminists were engaged in lobbying governments and in the parallel NGO forum. And there was a very strong participation always from Indian feminists. And there may be some Bangladeshis and Nepalis on the call as well, but it's been really incredible to work with the Indian feminist movement. And at that meeting, there was a real shift from more of a population control perspective to really thinking about and from population family planning, even though the word family planning that I never used, but is still used in some circles, was much more to one of reproductive health and reproductive rights. And then, of course, we use reproductive justice, even though that's not in any international agreements. And the idea at the time was that women should have the right to decide if, when, with whom, and how many children that they have, and that was more of a rights issue than an issue about controlling population size, which, as you know, was one of the strong emphasis in, quote, family planning and population programs in the 50s and 60s and even 70s. And so there was this real shift to one about women's empowerment, women's rights, looking more intersectionally at women's issues and knowing that if women were unable to have autonomy and control over their reproductive and sexual lives, they would not be able to have autonomy and control over other aspects of your lives. And so that conference really made some new commitments to the affordability, availability, accessibility of contraception. And then in the Beijing conference that happened a year later in China, and we were celebrating last year 25 years, there was more language again, where abortion is legal, services should be widely available and accessible. And so there was this language, always because these are UN documents, within legal parameters, but really focusing on accessibility and availability. And so advocates were able to use that language to say abortions need to be free if people can't pay for them. They need to be affordable. We need to train healthcare providers. We need to make sure that abortion drugs and contraceptive drugs are available and affordable in different countries. So there was a real push around that. If we look now 25 years later, there has been a backlash. I mean, as you all know, and as you all are experiencing, right? There's increased authoritarianism. There's been a rollback in certain countries. And so we as activists working at the global level are trying to just make sure that those commitments to contraception and making abortion available and affordable are still upheld by governments. And so there's a lot of advocacy in global arenas around that. But to be perfectly honest, it's a very difficult time. As you know, we are in a world that is controlled by very authoritarian regimes. We were very happy to have a change in leadership in the United States. There is an incredible amount of rebuilding and work that we are now doing because of the global gag rule. And as you know, our former president, who I will not name, who was not my president, did a lot of harm in our world, and the breadth and depth of his interpretation of the global gag rule has done a lot of harm. So what we're committed to now at the Global Fund for Women and IPAS and other progressive organizations is rebuilding and ensuring that we're repairing some of the harm that was done because the US had really rolled back its support for organizations that are working comprehensively on SRHR, including abortion. And one thing, just to let you know, the US government does not, with US tax dollars, ever pay for abortions. The global gag rule was about US reproductive health dollars not being used by organizations that would work on abortion using other sources of money. So there was a lot of confusion about that policy. But yeah, and I would say, over the years, there's definitely been a real push to thinking about abortion more as a human right, as a social justice issue, as an issue of global equity. If you look at maternal death and injury from unsafe abortions, they're primarily on the African continent and then some in Asia as well, but primarily in, across the continent. So there's real disparities in terms of who has access and who suffers and experiences death and injury. So there is a real push around that as well. I hope that answers your question.
Yeah, certainly. Yeah. Yeah. Others, if any questions, any reflections, please feel free to unmute or just put in the chat also.
Hello, I'm Osami. So I have just one thought. I was listening to the presentation and so there was a slide about the abortion helpline number that ma'am mentioned. So I was kind of looking for the same in India, and I was not very pleasantly surprised that there was only one such helpline number, and that too, which came around like last year. It says July 2020. and that again is saying more about like maternal health care and family planning. So I was just thinking that maybe as a food for thought for the participants who are actively involved in the fellowship, or maybe like working on any kind of project, to think more on the lines of having similar kind of maybe helpline, or as a first point of contact where a pregnant person or maybe somebody looking for information on abortion could actually uh, talk and have some kind of support.
Thank you so much, Musumi, for that great question. And what a great idea. What do others think?
Uh, Devika, you are not audible if you're speaking. Devika, I think you are having some network issues. Do you want to just put that into the chat then? Yeah, so if anybody, I guess like Devika can come back or like put it in the chat if anybody else wants to go next. So please go ahead.
And let me just say to Musumi and others, I would be happy to pull together, a list of some of the helplines and hotlines that we support, if that would be helpful at all. I gave some examples in the presentation, but just send me a chat or an email if you're interested in learning more, and I can put you in touch with those activists who set them up, because in some cases it's trying to influence government helplines to ensure that they are more intersectional and comprehensive and including abortion. And then in some other cases, they've just set up their own helplines and hotlines, and they have to staff them and update the trainings, and it's a big endeavor, but I'd be happy to tell you more. So I know that, so Subik, what my understanding is that groups are looking at different advocacy campaigns. Would it be helpful for groups to kind of, for you to set up breakout groups and for groups to think about some of their advocacy work and then to come back, or communications work, and then share what they're thinking, and then we can do that more collectively? Or what would be helpful?
Sure. Shruti, do you have any also thoughts around this? How should we go about it?
Yeah, I think it would be good to just do a breakout session. And if we have some, maybe we can brainstorm on some campaign ideas. And if there are, some other questions, maybe we can discuss that a little bit.
Yeah. Yeah, that sounds good. Why don't we brainstorm ideas and then everyone can. So what are some of the campaign ideas? Have there been ideas that you all have collectively been thinking about? Or, I mean, one idea is also to have a breakout group on, if Musumi wants, on the hotlines, helplines. I don't know if that would be helpful.
Yeah, I guess like we can have few breakout rooms where people can like roughly discuss on some ideas for 10-15 minutes, and then collectively they share back, and that might just resonate with others' ideas, and more collectively we can discuss about multiple ideas also.
Okay.
Okay.
So what time? So it's okay. So you'll break everybody up, and then what time should we come back?
I think 15 minutes. Within 15 minutes, we should, the group should be back. Yeah. And we have around 20 participants, so should be maybe in 4 breakout rooms. Vinita, would you be able to create the breakout rooms?
Actually, I'm not aware how to
Okay,
do that. If someone can guide me.
So if you look at the bottom, you know how to do it, Suvit?
Yeah, I'm doing that.
I'm like, you know how to do it, I'm sure.
Yeah, I'm just randomly assigning people. So
do you want me to be in a breakout group, or should I just come back in 15 minutes?
Yeah,
I'll
so
come back. I don't want to. I'll come back. I don't want to.
Okay, great.
Okay, cool.
Yeah, please give me just a minute. Just making these groups. Yeah, are people getting invites?
Yes, I think we are getting invited.
Oh, okay, great. Chetan and Krishanu, Devika, do you want to just join the breakout rooms? Vineet. Chetana, Devika, Vineet, are you able to hear me? Vinita, can you just check with Chetana, Devika, and Vineet? I'm not sure whether they're able to hear us.
Yeah, sure.
And Vinita, if you also want to join any of the groups, please feel free to join.
Yeah, sure. I'm just trying to locate Vineet's phone number.
Yes. Leila, do you want to join any of the groups, or you want to just come back to hear everybody's ideas together?
I think I'll just hear. I don't want to influence negatively. I'm sure that they'll come up with great ideas, but I'm here, so I'll just join when you bring us all back.
Okay, great. Okay, sure. So we'll be back in, say, in the next 13 minutes from now.
Okay, 30 minutes from now? Okay, perfect. Thanks.
13, sorry, 13.
13, sorry, 13. Okay.
Yeah, okay, yeah. Yeah, I think everybody's back now. So over to you, Leila.
Hi, thank you. So the different groups, sorry, were they all focused on their, I'm not sure what the different groups focused on, but do people want to report back? And then we can have a conversation. What were some of the issues you addressed? What questions came up? How can I be of support, and how can this group also help you with your thinking?
Yeah.
I
Yeah. Sorry. Yeah. I was just saying
so
that
we
we
were
can
in
go
breakout room
room
1.
wise. Yes. Yes. I guess room 1 can go ahead first.
Yeah,
Yeah,
sure. I think Shaurya will go ahead with. Shaurya, you want to go ahead, and because she was concising it really well. So
Okay, thanks, Anandita.
Yeah.
So, Leela and everyone, like we would want to shed light on two aspects of conducting advocacy that we were discussing in the group. The first one was more of an institutionalized approach to the advocacy, wherein we were planning that colleges here in India have a NSS or a social cell that already is functional. If we could reach out to colleges and have an exemplar webinar or a workshop for them for the sensitization of the abortion right, and promote them to take that as a goal for the year, and they could take this forward and add in volunteers to promote our work and advocacy on the same rights. That was an institutionalized way wherein every year we could have cells working on it, and we could work on advocacy for a longer run. And the second wave that we were discussing about was for the inline or already existing doctors and the interns who join in for the government hospitals. So we have Ashiana over here who's already working in a government hospital. So we're just talking how we could work on a sensitization training or a workshop sort of a model where we can have role playing done or different activities brought in to bring about sensitivity in how to address the women or the pregnant person coming in, and help in the interns as well as the existing doctors to be sensitized on the aspect. So these are the two ways we were thinking about it, but largely we were thinking about how to go ahead with our work. So yeah, Leela, please, it would be really helpful if you could give insights on both the aspects.
Should I go ahead and jump in, or should we wait? Would that be helpful if I go ahead and jump in? Or do you want to wait for all of the report backs?
I think you can respond to this if you have any ideas, Leila.
Yeah, well, I think that's very, very exciting. I think that there's been a lot of work that's been done around what has been referred to kind of as values clarification training. So it's somewhat of that sensitization, and it's working with people across, where values come from, how they're developed, how healthcare workers think about it. I really also just would say that I really, again, appreciate this group's inclusivity around gender and really using the language of people who become pregnant. And I have a couple resources I can share. They're Canadian, so I apologize for that. But they are about trans health services, trans needs around abortion. And there's just very little that specifically has been done, I think, around just busting the binary and not just thinking about women who become pregnant. And some of the values clarification, I think, is still, the language is still very binary. So I would just recommend that I can share some resources, and then I will send specifically this piece on trans healthcare services and rights around abortion. And then recently I reviewed a manual that Arrow produced. Do you all know Arrow? So Arrow is the Asia Pacific research organization. It's based in Kuala Lumpur. They work regionally, and they just produced a guide on abortion that includes tools around values. And it's something that I will. So should I just share all these with you, Suvik, and then you'll share out with others?
Sure. Yeah, that perfectly works.
Okay. Great, I will do that.
Also, Leela, that I had a specific question about, like, if we want to institutionalize advocacy in some manner in organization or institutions, do we already have research or any example that we can look forward to?
In terms of institutionalizing, sorry, you cut out. Sorry, I apologize, my connection. Can you just repeat the question?
So Leela, I was asking about, like, if we were to institutionalize advocacy in some manner for
Yes.
a larger reach out and for a consistent work to be done, do we
Yes.
have any examples of or any research done which we could just implicate directly and see for ourselves, do a pilot study on anything that we can refer to?
So you're thinking about institutionalizing within healthcare institutions?
Yeah.
Okay. Sorry. I'm just trying to remember who. There has been some. I think it's been done more. And again, I have to look at a little bit of resources and see what there is to share. I think what happens when you're thinking about institutionalizing, like what that means, it is about policies and practices and behavioral change and behavioral modification. And it's really thinking about what are the policies, practices, and accountability mechanisms that are in place to ensure then that the advocacy gets institutionalized. So I do think that there's some best practices around what policies need to be in place, what practices, it can get down to the specifics of, checklists and commodities of, supplies and all the things that you need to actually ensure that at the very practical level, services are available, affordable, accessible to all. If that's kind of what you're talking, is that what you're talking about?
Yeah, I was looking more towards the sensitization angle,
Oh, okay.
the information angle.
Okay.
How can we have, so we do look at these kinds of model in education where we have these cell established which work for work education or art training, wherein if you train the first set of group,
Yeah.
they train the next set of group for the same, and the work
Yes.
continues for a longer run. So that's what I was.
Oh, I see. Yeah. Sorry, definitely. So I do think that the whole trainer of trainers approach, what happens often with trainers is that you want to make sure that the people you're training then are the people who stay, that you need the training at all levels of the healthcare system. So it's not just training a certain cadre of providers, but it's training at the institutional level so that the training is done with directors, with managers, with all levels, and that there is follow-up. Like one-off training doesn't help. And so there's some modules that show that, you do the training and then you have mentorship and then you have an assessment and then the training, mentorship, assessment. You see what I mean? That it really has to be institutionalized in a way where one-off trainings in my humble opinion, they don't, I'm sorry, I don't mean to be disrespectful, but they don't really, it doesn't, one-off is better than nothing, but in general, the one-off doesn't, I think, result in the change that we want to see. The training and then the mentorship model, I've seen that work really well, where you actually are then modeling and implementing the concrete aspects of the training that have been done, and then assessments, to make sure to see what has changed concretely. So that's what I would recommend.
So that's often done in the education model very easily. But this would be my first attempt on doing something on an advocacy angle. So I just so in education it becomes very easy to monitor and assess. But in advocacy, it often blurs the line, right? Because you always have to keep changing with the policy changes. So thank you.
But email me if you want to keep in touch around it. Just let me know and I can send resources. I'd be happy to do that.
Yeah,
thanks for the question.
Thank you.
Hi again, this is Mosumi. I just had one suggestion, since Aishwarya was mentioning about the workshops and the sensitization aspect that she would want to cover. So, like, after 2014, there was a directive to establish gender clubs across the colleges and universities, and some of them are doing pretty good job. And also in the name of Gender Champion Club / Women Empowerment Cell, though I don't really agree with those language or the naming of such groups, but then some of them are really doing good job. And maybe if you want to like really kind of engage and be part of the sensitization project as part of advocacy, maybe you can approach them. And like, one disguised benefit of maybe this pandemic has been that a lot of them are also encouraging webinars, which was kind of not happening earlier, and they were mostly focused on physical spaces. So irrespective of where you are based out of, if you want to like reach out to some college, maybe you can try doing that.
Sure. Just for in the interest of time, do the other groups want to present once, and then we can have all the ideas put out, and we can continue the conversation.
Shall I go ahead?
Yeah.
Yes, please.
Yes, sure.
So in our breakout room, we talked about 2-3 ideas. I'll leave the basically what there can be a directory that can be developed around all the popular media, taking out clips which discusses about like the portrayal of pregnancy and abortion, and like in popular movies or in government, like public awareness campaigns done by ministries of women and child development and everybody. And there can be a directory to just show that how the pop culture or the media just shows pregnancy in a good way and a bad way. And it can be a building directory where things can be put out in, like it can start in one language, maybe in Hindi films and Hindi ads, and then can build on to become like a all language thing, like for like it can, anybody can add anything to that, like there sort of the basic idea. And then another is a capacity building campaign around the medical shopkeepers, like for like facilitations of medical what we call medical abortion, and also making them as a resource, like a source of contact, because a lot of women in community, like pregnant persons in community might go to, like we reach out for any health issues, we go to the nearby medical shop. So just including them in capacity building, because they have been left out of the conversation for so long, because we just think of them as some business person. But yeah, medical shopkeepers can also be part of a capacity building campaign or something like that.
Yeah, I love those ideas, but both of them. I mean, I think it's really important to look at again, culturally, how abortion is framed, and how certain ideas around abortion are perpetuated. And if you look, if you do an analysis of movie and film, that would be fascinating. I'd love to see it. I think it's a great idea to kind of put those together and also look at where there's examples of positive, narrations, and where there's agency and liberation and control. And on the shopkeepers, I totally agree with you. People, the bottom line is that people are also having abortions using pills and other herbs that are unsafe. And we do know that medical pills are safe and medical abortions are. And there's definitely a role in terms of just making sure that they have the information around safety and around what needs to be communicated. Often, in our experience, people who are self-managing abortions don't necessarily know what to expect. And so having clear expectations, having clear backup if things, as any, health situation, just being an agent, right? Being knowledgeable about what to expect and where to go, and to have a plan B, a backup plan if things don't go as expected is really important. And those shopkeepers and medication sellers are really important, are an important piece of the overall landscape. I shared the trans inclusive abortion services on the chat box.
Yeah, and also there was in the group, Dimple was talking about doing a baseline survey around accessibility to abortion in the community, and then proceed. That was like a create a form, like a do a baseline survey. That she was proposing that when we were having discussion. So yeah, that's it. If I'm excluding something, Dimple, you can add. And Krishanu, you can go for your, you can share what you were saying, like the Jogati and including Bai, like that thing.
Yeah. So I was talking ideating. So I thought about how we talked about midwives earlier, and we understood how there's certain people who are closer to the communities, and then access becomes easier. So we could do a workshop or a training of sorts where these people. So in Maharashtra, there are these people called Jogtis who are sort of midwives in a way, and they often also engaged in abortion and reproductive sort of health facilities. So we could train them or make them sort of persons of resource for a better access, or rather just awareness also. So in Bihar there's also Bais who dies, and Bais, people who are associated with this particular kind of work. So we could also work towards a training program which could be given to such people who could then become people who are then sort of helping trickle down the information and awareness to the communities at large. And another one that I had was about creating resources, and but these resources would then be centered around certain communities, like the community of sex workers. So how their needs from the understanding of abortion, and what peculiar needs are there of this particular community. So we could work around that, like a resource that can help disseminate information.
Yeah, I think that's a great idea. Are you all familiar? Do you know the Red Umbrella Fund?
No, I'm not.
Okay, I'm just going to share it. It is a fund that is sex worker led and sex worker focused. This is the link. And they do a range of advocacy, grant making, community work with sex worker led organizations and movements. Some of it's focused on, of course, work and other things, but they do a lot on SRHR as well. and abortion access. So you might just look at their website and see who might be involved from India.
Okay, that's like really nice information. Thank you.
Yes, of course.
Does the next group want to go ahead and share the ideas? Hello, is there anyone from the room 3?
Moshumi Saima?
Yes, I'm here. Sorry, I didn't remember the group I was in.
Yeah.
So we were essentially talking about the helpline aspect mostly, and so apologies, like the helpline that I was saying, it was established in 2010, but again, we were not able to find any kind of like data, for example, for the child line or for the women's helpline number that we get published, and we are able to understand like how many calls are being made. And Vinita also shared about the Disha clinics and the helplines that were supposed to set up under the Kishori Yojana, but we were also kind of not much aware about them. So the baseline, I think, was that we wanted to understand and assess how much information and what kind of information, especially around abortion, these helplines are able to actually provide, and that can only happen after like maybe some of us and people who are part of the maybe course or the fellowship like take this up and try to call them up and access the information. Like that could be the only way that we can understand how effective these helplines are, and if there is actually a pressing need for maybe one at a national or maybe at regional levels.
Yeah, I love that idea. I think that's a great idea. And I think there's a lot of really rich learning over the last around 10 years, actually, around helplines that have been set up really across the different continents. And I think that's a great idea. And I would be happy to share also some resources about what's worked and what kind of the things. I think there's some checklists from different helplines that have been set up to help just think through what is needed to set one up and sustain it.
Okay, thank you. That would be really great.
Does anyone from room 3 wants to share, or we can also move to room 4? Members in room 3, do they have any more ideas to share, or people who were in room 4?
I think Mosmi explained everything that we were discussing, so you can move ahead with the group 4.
Okay, cool, sure. So anyone from group 4 can please go ahead and share your ideas.
Salek, do you want to share or do you want me to do it?
No, I think you do it. That would be better.
Okay, so we were talking about two different countries. We were talking about Bangladesh and India. So in Bangladesh, it is, Salek was saying that, it could be very difficult sometimes to get support from community members, from religious leaders, because the stigma is so high. And a lot of times, even like young women who may have had abortion, they may not want to come forward and talk about it. So the stigma is very high. And in that scenario, just going and sensitizing somebody may not work, but you need to actually start from asking questions from people, from community members, religious leaders, so that you can also create your own language and create because language may not be accessible, the kind of language that we use may not be easily accessible for a lot of people. So it's important to also have a dialogue with them instead of going with a set agenda of this is what we want to do. So that was one discussion that we had. And I think in terms of the Indian context, some of the things have already been discussed. One is working with frontline health workers, informal workers, or ASHA workers who are in the formal system, and sensitizing them, doing values clarification with them over a period of time, so that it is not just like a one-off activity. So that was one thing. The other thing that I think we discussed initially in the first webinar was something around male partners engagement and their support in just seeking services. So I just wanted to sort of remind that was also one idea that we had discussed initially. And I think doing assessments of health facilities in terms of providing abortion, what are the protocols that they follow, what are things that doctors themselves are not aware about. So doing assessment of health facilities might be something that people may be interested in. Yeah, that's all.
Yeah, I think the assessment piece is really important. And then just, I mean, what you said, I always think it's important to like have a clear vision and use as progressive language as you can based on the context, but also really work with meeting people where they are. And that's in very different places because of the ways that, our social structures think of women and people who can become pregnant and abortion. So thank you for that. I appreciate it.
And just for Bangladesh's context, I mean, more of Leila, if you aware of this abortion service quality resource group. So they did come up with a tool to assess like abortion service quality, both from an client perspective as well as from a clinical perspective. And I know that Bangladesh was also one of the intervention countries. Do you have any updates or anything from that space?
I think, are you asking me, Suvik, or somebody else?
Yeah. No, yeah, I was asking you, like it was
yeah.
like IPAS,
No,
IPAS, and
yeah.
I guess metrics or measurement who came together to do this.
Yeah. I think that there's been some great studies done, and IPAS has led on some of those. What we were always pushing for is the user perspective. And so a lot of the quality of care, and it's important to think about quality from the perspective of the provider and the health service and the options,
Hey, can I just call you back in like 5-10 minutes?
Oh, sorry. Yeah. So I think, we've been thinking about it from the human rights of quality around accessibility, affordability, availability, and acceptability. I think that there's a lot more that can be done from the perspective of people getting abortions and ensuring that the quality is really intersectional in terms of trans right and non-binary rights and disability rights. And so I think that piece of the quality work, there could be more done around, as well as adolescents. And, again, making sure that it truly is intersectional and focusing on the person getting the abortion or needing the abortion and what quality means to them. I'm going to have to jump off in a minute. I have another call, so I just want to flag that. And thank you all. This has been such a rich conversation. I've really appreciated being part of this group, and I'm happy. Sorry, I did share some resources in the chat. I'm hoping, Suvik, that you can pull those together and share with everybody.
Sure. Yeah, we would certainly do that. And if you have other resources also, you can just email it to me, and I would ensure that it reaches every participant of the course. And very big thank you for doing this for us. And yeah, Vinita, you can close the session also.
Okay, well, thank you so much. Keep in touch and keep me posted on all these amazing ideas. They sound incredible. I'd be happy to reconnect and if it's ever helpful again. And yeah, I'm always happy to share and be a strong supporter and ally.
Thank you so much.
Leila. This
Thank
was a very
you.
helpful session.
Thank you, ma'am.
Thank you.
Thank you.
Thank you. Bye.
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 Take care.